Just when we thought COVID was behind you, broken by it's back and smarter. The new JN.1 variant is spreading rapidly across the UK, Europe, and the US in mid-2025. Hospitals are seeing a rise in respiratory cases, and scientists are warning, this strain is more contagious than its predecessors. But what makes JN.1 different? Should you be worried? Is there a new booster? And how do you stay protected without panicking? In this video, we'll break down everything you need to know, from symptoms and spread to vaccines and prevention. Stay with me, because by the end, you'll be smarter, safer, and prepared for what's next. Welcome to Global Health Guide, the channel that decodes today's biggest health headlines so you can protect yourself and your loved ones with clarity and confidence. If you care about public health, the NHS, and wellness facts beyond the media noise, you're in the right place. What is the JN.1 variant? JN.1 is a subvariant of the Omicron family, the same lineage that's been mutating since late 2021. But here's what's new. JN.1 has changes in its spike protein that help it evade immunity, meaning it can infect people who were previously vaccinated or infected. As of mid-2025, it's the dominant strain in many UK regions and is responsible for over 70% of new COVID cases in Europe and parts of the US. Unlike previous variants, it's spreading faster even in the summer, time when respiratory viruses usually decline. Symptoms of JN.1. What to watch for? The symptoms of JN.1 are familiar, but there are subtle differences. Common signs include sore throat, runny or blocked nose, dry cough, mild fever or chills, body aches and fatigue, headaches, mild shortness of breath, in older or at-risk people. But many patients are also reporting longer-lasting tiredness and mental fog. Unlike Delta, JN.1 rarely causes loss of taste or smell. It's milder in most cases, but more persistent, like a lingering flu. Is there a vaccine or booster for JN.1? Yes, and this is key. Moderna, Pfizer, and the UK Health Security Agency have updated booster shots that are more effective against JN.1. These boosters were developed to target newer Omicron subvariants and show strong protection against severe illness and hospitalization. If your last vaccine was before December 2024, experts strongly recommend getting the spring/summer 2025 booster, especially if you are over 50, immunocompromised, a healthcare worker, or have chronic conditions like asthma, diabetes, or heart disease. Booster programs have already rolled out in NHS clinics and pharmacies. Appointments can be booked via the NHS app. Treatment options in 2025. For most healthy people, JN.1 can be managed at home, but it's essential to rest, hydrate, and isolate for at least 5 days after symptoms begin. For high-risk individuals, Paxlovid, an antiviral pill, is still effective and available through prescription. The NHS is prioritizing it for the elderly and clinically vulnerable. Hospitals are not overwhelmed like in 2020, but cases are climbing, especially in care homes. Oxygen support and outpatient care are still the main interventions. A ventilator use is low with JN.1, which is good news. How to stay safe. Practical prevention tips. You don't need to panic, but you do need to stay smart. Here's what health officials recommend. Wear a mask in crowded indoor spaces, like buses, clinics, or supermarkets. Improve ventilation. Open windows at home, especially when guests visit. Wash your hands regularly, especially before eating or after public contact. Stay home if you feel sick, even with mild symptoms. Use lateral flow tests if you suspect exposure. Avoid visiting care homes or elderly relatives when unwell. The best prevention is awareness plus updated vaccines. And remember, if you're eligible, book your booster early. Don't wait until you're sick. Is this another pandemic? Let's be clear, JN.1 is not creating a new pandemic. It's a wave, not a tsunami. Governments are not enforcing lockdowns, but they are closely monitoring hospitalization rates. What's different in 2025 is our toolkit. We now have vaccines, antivirals, faster testing, and better public health awareness. The challenge is vaccine fatigue. People think it's over, but the virus doesn't care if we're bored. The more it spreads, the more it mutates. Staying one step ahead keeps us out of crisis mode. What's coming next? Scientists are watching new sublineages of JN.1 closely, especially in Germany and northern England. Public health agencies are preparing updated boosters for autumn 2025 in case of a larger seasonal wave. The WHO is still monitoring global trends, but as of now, JN.1 is serious, not severe. Medical experts agree. Public trust and information are more powerful than restrictions. That's why channels like this exist to help you stay informed without fear. If this video helped you understand the truth about the JN.1 variant, please give it a like. Have you or someone you know experienced this new strain? Share your story in the comments. It helps others feel less alone. And don't forget, subscribe to Global Health Guide for weekly updates on vaccines, viruses, NHS tips, and smart health solutions. Stay safe, stay smart, and stay ahead of the curve. We've got your health covered.